I will talk about this imaging accessory, and the primary aim is to basically look at its uses. Like if you are using it for the imaging for thorax spine, why are you using it? Okay, like what would be the advantages after use? So this is wedge filter. So this is what a wedge. So if I'm using a wedge to have an imaging of the chest, okay, well this one was actually used at the legs, but maybe they use it at the leg just to make sure that the chest is in good position. Do you understand? So a wedge filter is often used in what anteroposterior projection of the thoracic spine, and this compensates in the differences for tissue thickness across the chest. So the thoracic spine region has varying density. The upper chest is more thinner, while the lower chest, that's going towards the abdomen, because you have a lot of organs there, is much more thicker. If you don't compensate, the upper region will be overexposed, while the lower region will be underexposed. So wedge filter is what balances the exposures. The amount of light reaching all the sides is same. So the thicker end of the wedge is placed over the abdomen. So in real terms, okay, this was supposed to be used on it. Do you understand? This wedge, okay, well, this one is not really a flat wedge, okay, but the wedge was supposed to be placed there. You understand? So the thinner end placed over the lower thorax region. Okay, of course, thicker side to thin ends. You know, thin side to thick ends. Mounted, the filter is now attached to the collimator directly on the part of the X-ray beam. It is aligned so that the attenuation gradually decreases from bottom to top. So clinical benefits: it will give you images that are very clean. It will reduce repeated exposures, and because you have clean image, you now be able to make the right diagnosis once and for all.